Welcome back to another episode of The Heart of Local, where we highlight local businesses, providers, and programs doing amazing things in our community. Today, we're joined by Adam Sanchez, who is the owner and practitioner at Restoration Health Primary Care at Home. He is a board certified family nurse practitioner serving Marion, Polk, Lynn, and Yamhill counties in Oregon, with the goal of bringing full service comprehensive primary care directly to your front door on your schedule. Welcome to the show, Adam. I'm looking forward to our conversation and learning more about you and about what you do. So, as you
Thank
get
you.
started, what inspired you to start your primary care at home practice? When did you begin, and what has the journey been like getting started?
Yeah. Well, I had been practicing in family practice um, for going on, I was probably in my fifth year working in a high paced, high volume clinic setting and would come in and talk with patients and hear from them that um, they felt rushed, that they felt like they weren't getting full service treatment in the clinic setting, quick appointments in and out. And I realized as a clinician, I was feeling the same. I felt like I was being rushed, like I didn't have the opportunity to take the time that I wanted to with them. And it was about then that the seed was planted in my mind, my heart, to think there is a different way. There is a different way that we could do this, but how? And it was during about that 5 year mark that I um, switched gears, went into a smaller family practice setting, and enjoyed it. Had a little bit more time with the patients, but it was still the volume based, get them in, get them out mentality approach. So I was, although happy with seeing patients for a little bit longer, I still realized we're missing something here in the relationship piece of client patient relationship. And that's where I really started to lean in and felt like I was being pricked, you know, to to do something different, to take a risk, and to challenge the current model of healthcare. And so there it began. Let's provide care at home. And at the time, I was moonlighting also as a at-home nurse practitioner performing Medicare annual wellness visits. And I really enjoyed being in the patient's home and getting to sit with them in their environment, to talk with them on their terms and not be in a hurry. And that's where it really started to hit me that this is what I want to do professionally.
Hmm.
I enjoyed it. So go do it. Take a chance. And that's where I'm at today. I'm taking that chance.
That's awesome. So is this a new model for primary healthcare, or are there others who are following the same model, and then what makes you different from them?
Yeah, this is actually an old model being revisited. Um, my mother-in-law, who's in her early 70s, has told me stories of local doctors here in the Independence area that would stop by after their clinic hours and do house calls on her
Mm.
children, my wife. So it's not new, but we've definitely lost our way in providing this attention to being in the patient's home for probably a lot of reasons, systemically, financially, regulatory. So in revisiting this, and creating a direct primary care model um, in the home setting, it is new now because the direct primary care providers that are providing their membership services aren't going in the home on a regular basis, or their model isn't um, focused on at-home primary care like mine is. So I think this model, as I've set it up, is setting myself apart from the fantastic physicians and practitioners in the community who are providing direct primary care services um, brick and mortar style. I'm just
Mhm.
changing it up and really doing what my passion is, and that is taking the time in the patient's home to sit with them and provide comprehensive primary care services.
That's great. So you provide a full service comprehensive primary care. What services does that include?
Yeah, well, I always tell people think of it like if you took the day off work and came into the clinic, minus taking the day off work and going to the clinic. So no more waiting rooms, no more taking the time off, PTO, to go and sit in a clinic and be ushered through the doors and vitals taken and set in a room for a 7 to 10 minute visit. Primary care comprehensive services that I'm offering are just like if you were in my clinic room, where we would do a full set of vitals, say for a preventative exam or a wellness exam. Um, we would do a full physical, head to toe. We would talk about what's important to you that day, what's on your mind, what is it that you want to talk about today that we can take steps forward to help and improve, as well as what's the acute situation you may be in. Are you having any pains that need to be addressed? Are there any health goals that you want to address? So really looking at you holistically as a patient and
Mm.
not just a number on the schedule. I will provide sports physicals for kids, laboratory services in the home, so phlebotomy services for your annual wellness checks to look at your cholesterol levels, your risk for diabetes, your kidney health, your liver health, all of the metabolic panels that we would normally get in a clinic. I'll be able to do those from home,
Mm.
as well as renew any prescriptions, review medications that you're taking, um, talk about if they need to be taken anymore or the benefits, risks of taking them. Just again, holistic, comprehensive primary care services that you would get in a clinic just in the comfort of your home.
That's amazing. I can see the convenience of having primary care and those types of services at home and on my schedule. However, I'm really curious, how do you build trust, especially like with female patients? When you might be going into their
Yeah,
home and maybe how do you do that?
yeah. Well, just like I would be sensitive to you in the clinic as a female patient, I was always ask for you to invite your husband or your significant other or a family member in the visit with you. This serves as not only a safety precaution, but also an advocacy role for you.
Mm.
And anytime we can have people be a part of the visit and advocate for you, is what I want. That's what I desire. In the home care model, of course, if you don't have the family member available to you or the significant other, then I do offer a female chaperone service free of charge just for your comfort.
Or how does somebody onboard with you, or what's a next step um, if they're interested, and how does it look to get started?
Yeah. Well, if you see my business card or if you see any of the flyers I have out, or if you uh, talk with somebody who's received my services or been to my website, you can easily um, click on the schedule button within the website. If you've seen a business card or a flyer, click on the QR code, go to my website and hit the schedule button. And really, when you're scheduling with me initially, if you want to just have a 15-minute meet and greet just to see if you and I are a good click or if the services that I'm providing are right for you, that's what I encourage you to do. Or just call me with the number listed on the business card, 601-557 CARE 2273, and just ask me, do I have any availability and do I have the opportunity to meet with you for 15, 20 minutes? Happy to do that. Or you can message me or text me, whatever you're most comfortable with or whatever makes the most sense to you. Just reach out and have a conversation.
Sounds really easy. Sounds like it would be an easy way to onboard with you or to get to know you and see if it would be a good fit. I like that a lot. So
Yeah, and
what?
the benefit is you're not going different from the larger clinic systems. You're talking with me,
Mm.
you know, your provider. You're not in a phone queue. You're not leaving a message for the medical assistant. It's you and I having a conversation about what your needs are in that moment and what your goals are. And that's what I really want to set apart from, is I want to create that relationship.
Mm-hmm. So it sounds like, as you know, for somebody who has already established care, that you would be more accessible to them if they have a question or if they have a concern.
Yes, I provide 24/7 coverage via text, phone call, of course, if an acute need comes up. I have extended business hours. I work 7 days a week, and I have unconventional hours. So I realized that people work from 8 to 5. So I included hours that can see you before work, 5 a.m. If you wake up and you feel horrible, then
Mm,
let's talk before you have to make the decision on whether or not to take a day off from work. Conversely, if you work from 8 to 8, then my office hours will extend to time after your work, so that, again, you're not having to take precious PTO or time off work. I can meet you at home and we can do your annual visit or see
mhm.
your kid for their sports physical instead of having to rush to a clinic before they close or go to the urgent care. So, in that way, I'm making myself more available. And I also have secure telemedicine visit capabilities, so that if you wake up, or you're just not feeling well and we need to connect, we can jump on a video visit and have a discussion about what's going on and whether or not it's appropriate at that time to prescribe some medications and talk about what the next steps are in following that. So, unconventional, thinking
Yeah,
outside of the clinical box, the clinical or the clinical system is kind of my goal.
that sounds incredible. Really, really incredible. What is the most rewarding thing about being in someone's home, both clinically and professionally?
Hmm. The people. So I had a visit yesterday with an elderly gentleman in his home, and I was able to sit in the living room with the wife, their daughter, and the daughter's significant other. And being in the home environment tells a story about where the patient is, both personally and clinically, and even some of the barriers that they might face in meeting their healthcare goals. And it's a more intimate environment, right? He's in his easy chair. That's where his comfort zone is, in his easy chair. I want to be there.
Hmm.
you know in this case, it was unsafe for him to ambulate, um,
Mm,
so it was just a better option for me to come to him. But I also want to convey the sense of safety and comfort, right? If I can be in your home and we can sit in your living room and have a discussion about the same things we would in my clinical room, why not?
yeah. Yeah, and the advantage, like you were just saying, the advantage of actually seeing their environment, their actual environment, and seeing where there could be changes. And also, normally in a clinical environment, you wouldn't have access to those extra family members, or they might not feel
Correct.
comfortable coming along or whatever. So I love that.
Correct.
That's really great.
And quite frankly, uh, in the clinical setting, I wouldn't have the time to dig that deep into
Mhm.
what your home environment looks like as much as I would want to.
Yeah. Yeah. Yeah, I just love everything about what you're doing. I think it's an amazing opportunity for people in our community to have a different way of doing things. So,
Yeah.
yeah. And speaking of community, why did you choose to operate your practice in this community?
Well, I was born and raised here. I graduated from McNary. I went to school initially in nursing school at Chemeketa, and then went on to get my undergraduate and graduate degrees elsewhere, but raised my family here in this community. So it just makes the most sense for me to stay where I belong. We raised our kids here. Um, so my heart is really to be local and to
Mhm.
serve the community around me. Um, so that's where I'm most comfortable at, is this
Yeah.
community. I know it. I live here. So why
Yeah.
not serve it?
That's right. You're local and you're proud of it.
Exactly.
Yeah. Yeah. So what's next for your practice? Are there any exciting plans in the near future?
Yeah. So as we get up and running, right now I'm taking fee for service patients. So that's cash payment for an hour long visit in your home setting, to talk about whatever you want to talk about, to perform a wellness visit, to do comprehensive um, laboratory work, screenings, things like that. And then this summer, as I'm awaiting my uh, retainer certification from the state of Oregon, and awaiting the credentialing to process through the over 23 insurance providers that I'm going to be contracting with. Those
Mm,
should fall into place in the next 3 to 6 months. So August, you know, I should be onboarded with most of the major insurance players and have my retainer certification in place where I can have monthly membership
mm,
providers. So that's the most immediate on the horizon. And in future plans, I'd like to expand the services that I'm able to provide, to include pharmaceuticals, so
mm,
that in the case, little Susie has an earache and we're suspecting that based on the clinical information I've received, that when I get to the home, if in fact I can confirm with the physical exam that it is likely an ear infection, that I can bring the antibiotic with me and provide
mm,
that to you at a wholesale cost. So that's one of the major, uh, further down the road goals I have for the practice.
mhm.
Uh, but right now, it's just getting up and running and getting those credentials in place.
That's great. What's something about you or your practice that most people don't know?
Well, about my practice is it's really a passion, right? Um, I got into being a nurse practitioner because I love people and I wanted to provide excellent clinical care. So I just continued to go to school to achieve that skill set, the education and skill set to give it back to people. And it just makes sense that if I love being in people's home and connecting with them one on one with their families and friends, to make this leap of
Mhm,
faith,
mhm,
to provide it at the level of clinical excellence and standard of care that I'm proposing in my own community.
mhm.
So I just love that. I love it.
Yeah,
And that's what I'm hoping to bring to you is that passion.
yeah. Well, it's really coming through during our conversation. I can really tell that you love what you do, and I can just imagine that how it would be to have you in my home and giving care, that type of care that is available when I need it. And so I'm just thankful
Yeah.
that you've decided to take this leap of faith and to step out and do something new. And it'll be exciting to see how it all transpires for you and how it grows as people learn more
Yeah.
about you and as the word of mouth gets spread. And what is, I know you talked about it earlier, but what's the best way for somebody to learn more about you? Like, what's your website address?
Restorationofhealth.com is the website. And on the website, I've really tried to answer all the questions that somebody coming in who has heard about this newer model of care would want to have answers to. Um, you have all my contact information, my phone number. Again, feel free to text me if you want to have a 15-minute meet and greet just to see if this is right, or you just want to ask me questions about the services I would provide or how I could help you. Just pick up the phone or send a message. I'd be happy to have that conversation. Or call. If you're most comfortable, you're just not tech savvy, phone number's there
Mhm.
anytime, night or day. Just give me a call and have a conversation. Be happy to hear from you.
As we wrap up, Adam, thank you for taking a few moments to share about restoration health and primary care at home and your passion to make healthcare more accessible and convenient in our community.
Yeah. Yeah. No, thank you. we have to do something different. I think we all realize that, and this is just my effort at trying to do something different. So I hope it works. I hope people enjoy it, and I hope people benefit from it.
Yeah, I hope so too. Thank you.
Yeah. Thanks, Pam.